a chiropractor. Today I'm here to introduce to you guys what happens in a chiropractic session. There are a lot to do during the first visit. Upon patient's arrival, vital signs such as blood pressure, weight, height, and consent are taken. Next, during history taking, multiple questions regarding of the complaint will be asked. Besides, patient's psychosocial history, family history, and system reviews will be asked too. This is to gauge patient's general health and active daily living that may relate to the problem. After history taking, a detailed physical examination will be carried out, which consists of postural assessment, range of motion, static and motion palpation, neurological assessment, and orthopedic tests. These steps are there to help chiropractors to spot the anatomical structures that are responsible for patient's complaint. After physical examination, further imaging such as X-ray, MRI, or blood tests may be ordered. Once everything is done, an explanation of patient's complaint is given together with patient's prognosis and a detailed treatment plan. The treatment plan may consist of a few elements. For example, chiropractic adjustment, modalities such as ultrasound and shockwave therapy, home exercises, nutritional advice, and soft tissue therapy.
Hello everyone, good evening. Welcome to our World Spine Day event. My name is Adeline and I am representing ACM today and I'm your host for today's event. Just a quick introduction to everyone here. World Spine Day is celebrated annually on the 16th of October, highlighting the burden of spinal pain and disability around the world. This year's theme is Back to Back, and it reflects the need to reset and refocus on spinal pain and disability at home, in the workplace, in school, and also in our communities. World Spine Day 2021 Virtual Challenge is happening now until the 16th of October, which is tomorrow. So join now and finish the challenge to stand a chance to win prizes like Pulse Oximeter, vouchers, Fitbit, and so much more. For more information, just head over to our Facebook page or Insta page, which is Association of Chiropractic Malaysia, to know more in detail about it. Do drop us a message if you have any questions and we will attend to you shortly. Ladies and gentlemen, I would like to take this time to welcome both of our speakers. But at the meantime, if you do have any questions, you can drop them in the Facebook chat and we'll look at it and we'll answer it at the end of the session, all right? Okay, firstly, I would like to bring you Dr. Zoey. Dr. Zoey has a friendly and approachable personality. Her fluency is in English, Bahasa Malaysia, and in Hokkien, and it makes her a great communicator in understanding patients' condition. She enjoys doing yoga and going for fitness classes because she believes that staying fit is important for good health. Now, today, this session, we're going to make it casual. We want to be relational. So, Zoey, please tell us 3 things about you so that our audience can know you better.
Hi, everyone. 3 things about me. I like to play computer games at night when I'm not working. I have 3 cats. What else? I'm not very tall if you don't know me.
Yeah. Anything else that you want to tell the crowd? Some secret about yourself, maybe?
No. You asked 3 things to me, right?
Yes, that's the 3 things. Thank you, Zoey. Because just to let you all know, Zoey will be the second speaker of this session. So we're going to take Zoey down first. And I'm going to show you our our another speaker of the day, which is Dr. Sarah Tan from Welo Chiropractor. Okay, let's bring Sarah up. Sarah is a graduate from the International Medical University, also called IMU. Hi, Sarah. With an honors bachelor degree in chiropractic. She got into the chiropractic profession with a passion to help people get back to doing what they normally love and enjoy, and believes that by improving an individual's lifestyle, that person gets to fully enjoy what life has to offer. And I agree tremendously. She also loves getting to meet and converse with a vast array of patients. So say hi, Dr. Sarah.
Hi everyone. I can't actually really see anyone here, but nice to meet everyone.
Okay, tell us 3 things about you.
3 facts about me. Not very interesting, but first fact, I'm an introvert. Second fact, I like watching Studio Ghibli movies, so the Japanese animation movies. And the third fact, my favorite person to spend time with is my 2-year-old niece.
Aw, okay. Thank you very much. All right, so I'm gonna hand this session over to Dr. Sarah first. So like what we mentioned just now, this is a casual session. If you do have any questions, you want to ask something that you think might be maybe not very related, but you do want to know the answer, please type them in. If we are able to help you, we definitely will. So ladies and gentlemen, I give you our topic for today, dealing with scoliosis. I give you Dr. Sarah Tan.
Thank you, Adeline. Okay, hi everyone. Let's just get right into it. Today we'll be talking about scoliosis, of course, but I'm sure the most important question now, before we even start talking about scoliosis, is whether any of us here understand chiropractic and have had experience with chiropractic and chiropractors before. I'm not sure, is there like a live chat on the Facebook Live, but maybe you can leave comments below if you have had experience with chiropractic before and if you're familiar. And if you're not, no worries. I will just give a brief explanation of what we actually do. So chiropractic is a method of conservative healthcare where we focus primarily on the neuromusculoskeletal system. So that means anything to do with your nerves, your muscles, your bones, and your joints. And we look very specifically into the spine because it houses our whole nervous system. And what we do is to make sure the spine is well aligned, fully aligned, and we do so by using our hands. So if you can see in this video here, thank you to my very sweet patient who let me film her this morning. This is an example of how we carry out some adjustments in clinic and what we normally do in clinic. Sorry, I don't know why my video got no sound, so no satisfying sounds, but it's okay, too bad, what to do. So now that you understand chiropractic a little bit more, let's go into then what scoliosis is. So what is really scoliosis? How much do we understand about it? Is it as simple as bones of our spine, just one is out of place and it's misaligned, and that means that is scoliosis? Or is it as easy as you just sit on a too fat wallet, doesn't mean your spine will go sengit and go curved. So it's not actually so simple. There's a lot more complexities to scoliosis, and that's what we'll be covering in our health talk today. We'll be talking about many different topics, but of course the goal of today is to educate general public a little bit more about what scoliosis actually is, so that we just have a better understanding on how to identify it in our day-to-day lives. It's just a basic understanding and knowledge, but of course knowing a little bit is better than nothing at all. So I'll be covering the understanding scoliosis aspect. I'll be also looking at common signs and symptoms, and I'll also then later be passing the floor to Dr. Zoey, who'll be talking about how to diagnose scoliosis and treatment options for scoliosis as well. So in order to understand what scoliosis really is, we have to first understand what is normal anatomy and what normal is, because scoliosis is obviously a deviation from that normal. So if you look at my slides here, the first one on the left, the first picture on the left, this is how a normal spine should look like if you look at it from the side. So from the side, we have our cervical, which is our neck, thoracic, which is the upper back, and lumbar is the lower back. Sacrum coccyx is where our buttock is situated. And from the side, we want to see 3 healthy curves. So the neck is the C curve in, the upper back is a curve out, and the lower back is a curve in. And the purposes of these curves is to just help us hold up and balance our body better. But whilst from the side, we should have curves, from the back, we shouldn't. So from the back, we should have a nice straight spine. And this is typically what we want to see in a normal spine. So in scoliosis, what actually happens is that from the back, instead of a healthy straight spine, we see curves in the spine. So sometimes you will see a upper back curve, either a C-shaped curve. Sometimes it's in the lower back. Sometimes it's a mix of both your upper and lower back. And sometimes it's an S-shaped curve where upper back goes to one side and lower back goes to the other side. And the most easy way to really definitively diagnose scoliosis is using this definition here, where there is a sideways bending of your spine more than 10 degrees. So you have to take x-rays to measure, and it's accompanied by some spine or vertebral rotation, meaning some of your spine bones not just slant, but also twist or rotate. So when we look at scoliosis, there are also many different types of scoliosis. Of course, we will cover the most common type. If we go through everything, then I don't think we can finish by tonight. But looking at the most common type is something called idiopathic scoliosis. So idiopathic means of no known cause or origin. So sadly, I cannot tell you why a scoliosis actually happens. There are two other main branches of scoliosis. They are called either congenital scoliosis, meaning you're born with this birth anomaly, so a birth defect that causes the curve, or a neuromuscular scoliosis, meaning it's a curve caused by a different condition. But these two aside, these are much less commonly encountered. What we normally see in clinic are idiopathic scoliosis. And under idiopathic, we have 4 different categories, and normally we categorize according to age group. So there's infantile, juvenile, adolescent, and adult. The most common out of all is adolescent scoliosis, meaning happening in those aged 10 to 18 years old. And then when we talk about how we cannot really identify scoliosis in terms of the cause and origin, then it becomes a bit tricky. So how do we prevent it? How do we know whether someone is more likely to have scoliosis or not? Then we look at the next best thing, which is demographics. So it tells us who is more prone to having scoliosis. So just to get a better understanding of scoliosis, it affects 2 to 3% of the worldwide population. And there's a 2.55 prevalence rate in Malaysia. 2.55% sounds very small, but I purposely did the maths for this. It's more than 800,000 people who will be affected by scoliosis. And it normally affects those who are in the 10 to 15 years old age range, and also more commonly in females. You'll find that the scoliosis is serious enough to have to require treatment. So not to say that only females get scoliosis or more females get scoliosis, but females are 7 to 8 times more likely to have scoliosis bad enough that they need a treatment for it. So just to then summarize all of that understanding of demographics into then risk factors, so things that we can specifically look out for. The 3 main ones, like I mentioned earlier, age and gender. So age between 10 to 15 years old. Gender, if you're a female, then there's a higher chance. Then another thing is family history. So if there is anyone who has immediate family specifically, who also has scoliosis, there's a higher chance that you might have scoliosis. There's also some research that shows that you might have a scoliosis curve of a bigger magnitude, meaning if you have a history in your family of having scoliosis, there's a chance your scoliosis curve might be bigger than the average as well. And now that we understand a bit more about who scoliosis affects and how commonly we see scoliosis in our day-to-day, the next question, of course, is then how do we detect scoliosis? And we normally look at common signs and symptoms for this. And we normally get this question also. So does scoliosis hurt? The assumption is that scoliosis will hurt a lot because when you see it, it feels like it will be very pain. Your spine is sengit. So like, wouldn't it hurt a lot and wouldn't it be very terrible to experience? So then let's go to this fact or myth. Do you think that all aches and pains in people who have scoliosis, so scoliosis cases, do you think that all of them are only caused by scoliosis? I will ask you to leave in the comments again, but it's very funny. I'm actually talking to myself, so I don't really know what the comments are saying. But I will answer myself then. So it's a myth. Not all your aches and pains are caused purely by scoliosis. Of course, when you have scoliosis, you might be a bit more prone to having more aches and pains because there is a bit of that muscle imbalance, but it doesn't mean that every single thing you feel is because of your scoliosis. And in fact, it actually, in most cases, an adolescent scoliosis, so those who have scoliosis between 10 to 15 years old, in most cases, they go undetected because they don't have any significant pain or symptoms. We are normally actually a bit more surprised if teenagers present to clinic with a lot of complaints of aches and pains when they have scoliosis. Most of the time, you don't really realize that they have scoliosis because of the pain. So if it's not because of pain, how do they really know, and how do they know enough to want to come into clinic to see us? And normally it's because we look at features of scoliosis. So seeing how it looks like from the external, And this is then a sign. So it's not a symptom, it's not something they feel, it's something that visually you see. And most of the time in teenage cases, it will be parents who suddenly notice that, how come my son or my daughter is standing a bit sangat, or their posture doesn't look so nice. And just to give you a brief run through, so maybe you can look out for this in people that you know as well. So if you look at the left normal spine, when you stand up straight, it should be nice and even. But in spines with scoliosis, some people have uneven shoulders. So nobody is perfectly symmetrical in their body. Everyone will have a bit of uneven shoulders. So if you see an uneven shoulder, you don't have to be like, oh my goodness, I have scoliosis. But normally in scoliosis cases, it's a bit more obvious where one is a bit higher than the other. And you also see that the shoulder blades from the back, there will be one that protrudes out a little bit more. So if the person is very skinny, sometimes you see that bone juts out a bit more. Or if you run your hand across, sometimes you can feel like one will bump up a little bit more. Also, the hips would then be uneven. So sometimes one hip will appear lower, one higher. And another thing would be having an asymmetric flank. So when your body is curved to one side, naturally, when you stand straight and you have your body with your hands at the side, normally you should have a roughly even gap on both sides in between your hands and your body. But in asymmetric flank, you see one side has little to no gap and another side has a very big gap. And normally these are like the biggest telltale signs that the person might have scoliosis. And these are good ways to do a rough screen if you have kids or nieces or nephews, or you know anybody who sometimes when you stand, it looks a little bit funny. You can try to look up for these specific things. Okay, this is a very quick and brief introduction to scoliosis, and this is roughly my end of the first part of sharing. But of course, the main takeaway I would give from my side is when we do understand scoliosis and we do know how to detect it a bit better, then the most important thing is to know that early detection is important. So my colleague, Dr. Zoey, will discuss and talk about it a little bit more later. But basically, when you are able to detect scoliosis earlier or bring someone who you can tell something is a bit off and you bring them to the right healthcare professionals, you're able to diagnose things faster and you're also able to eventually treat it faster as well. And when you treat it faster, you will slow down curve progression and so on. So I'll pass the time to Dr. Zoey, who will then be talking about how to diagnose scoliosis. She'll be giving suggestions and ideas of how we can do rough screening on our own at home and how we as chiropractors diagnose scoliosis. And she'll also be talking about treatment options on the chiropractic side. Then after that, I will come back and I will just go through some key points of our talk today before we go into Q&A. So without further ado, I pass the time to Dr. Zoey.
Okay, thank you, Dr. Sarah. So now I'll be talking about how chiropractors diagnose scoliosis and also some treatment options for scoliosis. Okay, to diagnose scoliosis, mainly we will look into three different things, mainly the history taking, physical examination, and also the X-ray. In history taking, usually we will ask questions like, do you have any family history of scoliosis, any symptoms or pain, any past injury, or any previous treatment for this condition? So after knowing a bit better about the person's condition, we will then go into physical examination. So during physical examination, we will look at the patient's posture from the back and side. We will also palpate the spine just like in this picture right here. You can see, yeah, hold on. Okay, so just like in this picture right here, you can see that this is how we usually palpate the spine to look for any restricted motion, tenderness, or swelling. Besides that, we also do neurologic examination to check for reflexes, sensation, and strength. Other than that, we will also do Adams test, which is something that looks like this. So if you're wondering actually what is Adams test, right? This is something you can do at home as well. Let me play the video for you. Hold on. Okay, so as you can see, this patient has a higher left shoulder and an obvious right upper back hump. However, for some people, right, the scoliosis may not be so obvious, which is why X-ray is still the gold standard when it comes to diagnosing scoliosis. So when we suspect scoliosis in a patient, we will always refer them for a full spine X-ray. because in this x-ray, we will be able to see how severe their curve is. That's number one. The second one is we will be able to tell the exact location of the curvature. So if you look at this patient, so this is the left and this is the right side. We flip the x-ray over so that it's easier for the patients to look from their back. So if you see here, this patient has a curve on the right upper back and a curve on the left lower back. So the curves goes to the right on the upper back and goes to the left on the lower back. For those aged below 18, we will usually have to monitor their curvature closely because there's a chance for them to grow taller. So as long as there's a chance for someone to grow taller, there's also room for the scoliosis to worsen. On average, a new x-ray will be taken within 3 to 6 months during treatment so that we can monitor their curvature closely. So now, once we know a person has scoliosis, right, how do we actually treat them? First, we will perform chiropractic adjustment, and then we will give recommend the patients to go for some scoliosis-specific exercise and also bracing. So chiropractic adjustment, right? For those of you who just joined and missed out on Sarah's explanation on chiropractic adjustment, it actually looks like this. So the first video is a video of me doing an upper back adjustment. Yeah, I'm sorry, the video is a bit slow. Yeah. And the second video is actually a video of me doing a lower back adjustment. So many people actually think that adjustment is just random cracking of the spine, but actually we do many checks before we do the adjustment. So it doesn't look as easy like, just randomly cracking the spine. So in the next few slides, I'll be sharing a case of my patient. She took a new x-ray after actually 10 sessions of chiropractic adjustment in 6 months. She came in with low back pain and neck stiffness and had a history of serious motor vehicle accident, which is probably why you can see over here, this is what we call the obturator foramen, right? And this is the pelvis. We can see that her pelvis is very rotated. The motor vehicle accident could be one of the reasons why her pelvis is so rotated. So as you can see here, the one on the left is way bigger than the one on the right. And after 10 sessions, you can actually see improvement in the obturator foramen, meaning the pelvis is less rotated, is in a more correct alignment. So why do I mention this, right? Because pelvis is a foundation. It's like a building. If anything goes wrong at the foundation, right, everything above will sort of follow the curvature of the pelvis as well. So to make it clearer to you, I'll show it with this spine model. So if you see here, this is our pelvis, right? And if I start rotating the pelvis a bit, right, this way to one side, you can see everything above sort of follow the rotation as well. Yeah. So if I rotate it this way, then the lumbar spine above will also follow the rotation. Or in some cases, one hip is higher than the other, like what Sarah mentioned. So if it's this way, you can also see some tilting of the spine above as well. Yeah. And in this slide, you can actually see that her curvature has also slightly improved, even though it's not a lot. The one before is more away from the midline, and the one after is actually nearer to the midline. So, and another thing that we look into is actually we call this the wedging of the disc. So this is the bone, and in between these are the discs, right, in gray. So you can see over here, even though it's not so clear, the wedging in her spine is actually more compared to the one on the right, meaning the one on the right, this wedging is actually lesser. And then in this slide, you can see that the neck curvature also improved. So if you don't know, a normal neck curvature should actually look like this. Yeah, so why do I show you this x-ray, right? It's actually to tell you that chiropractic adjustment can actually change the structure of your spine and your pelvis if the right adjustment is given to the right segment. So another treatment that we utilize in clinic is Schroth method. When you have scoliosis, right, the muscles on one side will be tighter than the other side. So the goal of Schroth method exercise is to rebalance the muscles and to retrain them so that it can support your spine better. But this is one of the exercises that we use in clinic. However, different clinics, they have different methods of exercise for their patients. So in some extreme cases, right, we will usually recommend bracing especially for kids, to keep their curve from progressing to the level that surgery is required. However, in most cases, physiotherapy and chiropractic adjustment are effective enough to limit the curve progression. But like I said, right, this is actually a case-to-case basis. It really have to depend on the age of the patient and the severity of the condition as well. So people usually think that chiropractic adjustment can sort of straighten the spine. So I have patients coming in to ask me, right, I have scoliosis. Can you actually straighten my spine by doing adjustment? So actually, this is a myth lah. We cannot straighten the spine. Our goal is always to limit the curve progression, but never to straighten the spine. The only way to straighten a spine is through surgery. So what chiropractic adjustment can actually do is to improve the spinal mobility. So when we adjust the segment, the mobility of that segment will be improved. So this will lead to a reduction in nerve interference, and then there'll be a reduction in joint and muscle stiffness and overall better quality of life. But you must remember, even after a few rounds of treatment, coming back for chiropractic maintenance once a month is important to limit your curve progression. Yep. Now I'll be passing on to Sarah for her to summarize all the key points of our talk today. If you have any questions, please feel free to drop it at the comment box below.
Hello, I'm back. Is the slides on mine? Okay. The slides should be my slides now, by the way.
Never mind, let me do it for you.
Okay, that is what you do for me.
Yeah.
Okay, so thank you everyone for listening so far, and thank you for being so patient with Dr. Zoey and I. Now to just go through, so there's a lot of information to cover and there's a lot of things to learn and understand about scoliosis. So let's say we were to just summarize it into 4 main key points for you to take away today. If you cannot remember anything at all, at least remember these 4 things. So first one is that scoliosis has a higher prevalence in 10 to 15-year-old females. So then if it falls into this category, and if that third risk factor, if you remember, you should put in the comments. Should I wait for you to put in the comments? The third risk factor is, nobody replied, but it's okay, it's family history. Well, if you meet these risk factors and anyone who meets these categories, it is important to get them screened early as well. Second key point is that x-rays are the gold standard, like Dr. Zoey mentioned, but you can also screen for scoliosis at home. So just like how she mentioned earlier with the Adams test, make sure the person is standing straight, arms clapped together, and then you bend forward. The person who is checking should be behind the person you are checking, and you want to see that the back is a nice even flat line. So when the back has a hump, like in our picture here, then that means that is indicative of probable scoliosis. Third key point, a conservative treatment does not straighten the spine. So the goal with getting treated and making sure that you go for routine and maintenance chiropractic adjustments and for exercise sessions, rehab sessions, is not to straighten your spine, but to improve your overall quality of life. And the fourth key point is it pressed? Am I the only one who can't see it?
Sorry, my bad.
Oh, okay, it's not. Okay, so the fourth key point is that early detection and treatment is important, especially when your child is still growing and bones have not matured. That is the most important time to get them treated. You don't want to wait until it becomes an adult case. You want to make sure that you are continuously treating and monitoring throughout their whole teenage years, especially as they're growing up. Okay, and that's it for our key points. That's it from our side. Thank you so much for listening. I know it's a Friday night and you can do other things. Actually, now with COVID, you shouldn't be doing too many things as well. But the day before your weekend, thank you so much for joining us. We'll actually be going through some questions now, and we'll pass the time back to Adeline, who will, Dr. Adeline will moderate our question and answer time with us.
All right, thank you, Zoey and Sarah. Yes, our questions are coming in. Let's give them a few minutes to continue writing, but here's one. This is from Michelle. She's asking, any one of you can answer, can we carry heavy things or exercise if we have scoliosis? What do you think?
Okay, so I think I'll answer that. If you have scoliosis, right, it doesn't mean that you should work differently than just people without scoliosis. You can still carry heavy items or do any sort of exercise. It's just that, like I said, because you have scoliosis, right, so your spine are more prone to misalignment due to all the muscular imbalance and all the wedging of the spine, right? So because of this, you should regularly see your chiropractor to maintain it from time to time. And also when you carry heavy items, you should know the correct posture of carrying heavy items, and like not bending your back when you carry heavy items, things like that. Even for people without scoliosis, you should also practice the same thing. So if you have scoliosis, there's not much difference compared to if you don't have scoliosis. Yeah.
I think the thing about awareness is what we are doing now, because sometimes if you do know anything about scoliosis and suddenly you see someone or your own child who has a crooked spine, I believe that person will be very anxious. But now that we have this session, it's an intro to scoliosis. But I think with this, then with all this info, we get to really make our choices better and we get to really live better lives. And I think that's really important. Okay, second questions. These are for the moms to be. Will scoliosis affect pregnancy?
Okay, good question. I'll answer that. Scoliosis shouldn't affect pregnancy in any significant way. There's a lot of research that shows that you can have a healthy pregnancy and can give birth to healthy, pretty, cute, chubby babies with scoliosis or without scoliosis. At most, because with scoliosis, you're a bit more predisposed to having more aches and pains. And in pregnancy also, without scoliosis, you will also have a lot of aches and pains. Maybe at most you'll feel a bit more uncomfortable sometimes, especially in the later trimesters when your fetus is getting heavier and your belly is getting bigger. But it's good to get yourself checked then, go to a chiropractor regularly, especially if you have scoliosis in pregnancy. But even if you don't have scoliosis in pregnancy, it's a good thing to get yourself regularly adjusted. But end result, the take home is that no, it shouldn't affect your pregnancy.
And it's safe to go for chiropractic treatment when you are pregnant. Is that correct?
Correct.
Okay. All right. Our next question. This is from Valerie. She's asking, must I go for surgery if my scoliosis is above a certain angle? Be it for kids, adults, older people.
Yeah, I believe this is also a case-by-case basis, because for some people with scoliosis more than 50 degrees, for example, right? Because usually scoliosis above 50 degrees will be recommended for surgery. But then I have many patients with scoliosis, at 60 degrees, 55 degrees, but they are still living as usual because it does not affect their activity of daily living. However, if you have scoliosis to a certain angle where it starts to affect your breathing, right? Because when you have scoliosis, then your rib cage will also sort of follow the curvature of your spine and then starts pressing on your lung. Then that's when maybe scoliosis, maybe you need to go for surgery. But I think the best is always to come in for consultation first. Then we can actually check and let you know what's the next step.
Mm-hmm. Yeah, because a lot of times when people think of a crooked spine, people will straight away relate to surgery. And I think now we're offering education and telling them that it might not always be that case. Sometimes there are other things that you can go to. Okay, let's see what's our next question. This is from Pauline. Good evening. Is there any exercise that a person with scoliosis should avoid? For example, gymnastic, contact sports, even yoga, for example, which I think is a very hot topic nowadays, and HIIT. What do you think?
I'll answer that. So that's a bit of a case by case as well. So there are some people who, let's say you are well versed enough with certain exercise or you have trained yourself enough, there are quite a lot of exercises you can cover. I think the baseline is that you are aware of your limitations and how much you can do, and you progress gradually and not suddenly. Some people do want to avoid, if they're not very sure or certain, you want to avoid things where there's a lot of bending or twisting of your spine. So that's a bit more risky in that sense. Sometimes people, if you're not really sure of what correct form is or proper posture is, and you go straight into heavy weightlifting, that's also something you'll be cautious about. Gymnastics, like you mentioned, has a lot of bending and twisting of the spine. So it's not to say that you cannot carry out gymnastics or you cannot do it as a sport. Maybe having that awareness and knowing yourself and consulting the right professionals, whether it's your chiropractor or someone who is well versed in that sport that you enjoy, and knowing what you can do with your body, then that will be the best step forward. So there's no definite answer of like there's this and this and this exercise that you cannot do. Yeah.
Mm-hmm. It's really knowing our body and choosing to tailor our needs. Yep, you're correct. Okay, two more. Shanha was asking, how does the neuroscope works? Since after adjustment, there will be an overall heating around the area, which makes the temperature to be somewhat equal with both sides of the spine. This one, I think one of you might need to give a bit of a background education first, because I think a lot of people would not know what the neuroscope is. Would you explain more to us?
Okay, so should I show a picture of a neuroscope? Because a neuroscope is something that we use in clinic, right? It's a scope that we actually use to scope the patient's spine. The reason for the scope is actually to look for nerve inflammation, right? If there is any sort of nerve inflammation in that area, it means that probably there is some sort of misalignment going on. But this is a bit too technical lah. So to answer his question, right? Usually, it's true after adjustment there'll be overall heating around the area. But then, for me personally, I don't use Novoscope after the adjustment to check again, because there are some chiropractors who use it before and after. For me, I just use it before, so I check and then I find out the problem area, and then I'll just don't use it after that, even after the adjustment. Yeah. So that's what I do. Yep. Does that answer your question?
I believe it does. Okay, Jonathan asked, will scoliosis affect sports performance?
Okay.
Sounds like a sporty person.
Right. Should I answer that? I'm not a very
Yeah.
sporty person, but I'll answer anyway. Pertaining to my previous answer as well, I think scoliosis shouldn't limit you from doing anything that you think you can do and anything you're interested in doing. Maybe at most, I mean, as with any chronic injuries or chronic body issues that people will have, it will of course affect either sport or your day-to-day living in a certain way, but it's figuring out and learning how to deal with it. And I've met athletes who have no issues with any of their sport, even though they have scoliosis. So I would say not exactly. I don't think it would affect sport performance significantly. I think that when you're able to train according to your body, like I was mentioning earlier, you can do anything without worrying about it. But maybe it's working a bit harder sometimes in certain areas.
Okay. We have a few thank you to both of you for answering the questions. We have another question. This from Wei Chi. She's asking, would poor posture worsen scoliosis? You know, especially nowadays when we're at home, it's always e-learning for the students, hunchback, even for parents who have to be accompanying the kids. Will this cause scoliosis? Is scoliosis, like a COVID thing that's going to come up from it?
So am I going to answer that?
Either.
What proportion? Actually, yes. But then, like I said, even people without scoliosis also, right, we shouldn't be sitting in a very bad posture like this, because after some time, you'll be prone to a lot of spinal misalignment. As for people with scoliosis, they are more prone to misalignment due to the muscular imbalance, right? So, like, for example, I'm going to use this again. Yeah. For example, let's say this person has scoliosis, okay? So if this person has scoliosis and this person also starts to slouch a lot when he or she sits, right, then this will predispose the person to even more spinal misalignment, because when you already have a curve in your back, it means that your whole spine is actually not in a very balanced alignment. So yeah, to answer your question, yes, it will worsen scoliosis.
Okay, so posture is a very big thing that all of us need to take care of. And I think especially for parents, kids' posture is a very headache thing for them because you can scold kids, you can nag them, but people don't really, it takes time, okay? All right, next question. What is the ideal posture for desk sitting? Ergonomics?
Oh, good question. I guess it's not really scoliosis related already, but still a very good question. What's the ideal posture? Yeah, it's still chiro related. So I'm aiming because there's a lot to answer and there's a lot to go into about workplace ergonomics. Of course, you want to go into very big details. You have to talk about chair and table, making sure that everything is like a good height for your body. Everyone has different heights and different body ratios. So you want to make sure they match your body. most of the time, the general rule of thumb is that you want to make sure you're using your full chair for support. So sitting with your buttocks all the way in, you use your back support. You don't want to, Dr. Zoey is not doing that. You want to make sure you don't slouch forward. You want to you want to make your desk work for you, right? You don't want to go towards it. So you want to bring your computers, your laptops, your mouse close to you as possible so that your arms don't come up and don't scrunch up. So the ideal is to make sure everything is relaxed. But of course, when we're talking about being in a pandemic and sitting at the desk for long hours, it's it's a bit difficult to answer because like a pandemic sucks lah, and we all cannot move around a lot anymore regardless, and it feels very uncomfortable very quickly for a lot of us because we've been stuck at home for so long. Sometimes the ideal posture on top of all of this is also just making sure that not just that you're always sitting in the correct straight posture, but to make sure you're moving a bit more consistently. So then making sure every hour or so you are standing up to readjust your posture, or drink a lot of water so you have to go pee a lot so that you have to faster like get out of the chair more frequently. I think that is the ideal for me, that if I had to sum up, is just to keep yourself moving a little bit more instead of just staying in one posture, because there's no one good posture for everyone. Everyone's a bit different.
And I've also known people who will set alarms every 30 minutes, every 45 minutes, and force themselves to walk. And I think a very big thing also is how we place our laptop or our desktop. It has to be eye level. Do you want to talk about that as well?
Yeah, so talking about eye level laptops as well, it's making sure that, so you want to look straight ahead. So if the laptop is too low, then you drop your head down. If laptop is too high also, it's not helpful because you look up. You want to make sure that if you cannot bring it to eye level, you can put on laptop stands, or if it's a monitor, then sometimes people put thick textbooks underneath. Even talking about monitors, some people use 2 monitors, right? And then they will get a neck pain from like looking, or like you turn to one side a bit more. So you always want to make sure you're right in the center of both monitors, right in front of you like this, so that you don't have to purposely tilt to one side too much. Yeah.
And it also applies to phones. Don't look at your phone like this. You really have to bring it up. That's a big thing as well. Okay, let's move on. Hui Min Chu asks, people with scoliosis, is it okay to go for massages? There's aromatherapy massages, as Thai massage. I think there's a lot. But any advice from you all?
Yeah, I think it depends on the massage, because if you go for massages, I haven't been to any myself, but I've heard people saying, you know, sometimes I go to this massage and then they will help me crack my spine, things like that. And I think that's not very good, because especially like if you're already seeing a chiro and then you go for a massage that has like cracking of the spine also, it may be hard for your recovery as well, and may make things worse. But if you're just talking about normal massages, I think it's okay.
Okay. We're going to switch the gear a little bit. Zoey, I think your chair is gaining some popularity here. Your chair looks very relaxed. People are eyeing on your chair now.
Yeah,
Any
this
guidance?
is not my chair. This is my brother's chair, but as you can see, it's like TT racing, right? But then to me, I don't usually recommend people to get gaming chair. I don't know, this may sound very controversial lah, because I'm sitting on a gaming chair and then asking people not to get, right? But then actually for me, you can get any chair as long as like you can actually adjust the height of the chair and there is a back support for you. And I think that's good enough. And you can even get very cheap chairs. You don't have to purposely get chairs that are thousands of ringgit. Yeah. So as long as you can adjust the height, right, according to your preference, and get like a lumbar support for the back, then it's good.
Yeah. I think as like what you say, if you can bring it up, you can put it down, it has to match you. And that's why personally, I feel that if you are the person to go get a chair, you do need to sit on it. Asking someone else to buy for you might not work. Same with sofa and so on. So we always tell people that if anyone is getting sofa, remember to bring your family members along, because if that chair is suitable for you, it might not be for the other member. Yep.
Yeah.
Brenda is asking, is there a relationship between scoliosis and chronic fatigue?
Hi, Brenda. Hi, Brenda. I know Brenda, so I feel very happy. I'll answer that. Can scoliosis cause chronic fatigue? It's a yes and no question. I think chronic fatigue has, like fatigue in general, has so many factors of something possibly causing it. Scoliosis can be one of them because your body can feel tired more easily. You have a lot more effort to hold up good and correct postures because naturally you're already curved to one side. But whether it's the main cause, it's a bit hard to say. Sometimes there's so many other factors that we have to look into, like stress, or even with scoliosis, are you practicing the right exercises? Are you sitting right? Is your bed comfortable for you? Are you getting proper sleep at night? There's so many things to look into. So it could be a contributing factor as to why you feel more easily tired, but I wouldn't say it's the definitive causative factor. Like it's not the only thing that causes fatigue. And that if you have scoliosis and you find that you feel tired very easily or very frequently, then maybe there are a lot of other factors you want to try to eliminate first. And that's something that you can do with your chiropractor, and try to eliminate every other possible cause, and also dealing with the scoliosis and making yourself feel comfortable just to reduce anything that is making you feel so tired and so fatigued.
Mm-hmm. And I also think this is a good opportunity to let everyone know that health is multifactional. I would say it's your physical health, it's your mental health, it's your social circle, it's the things you eat, it's the things you think. It's a lot of things together. So fatigue, I mean, it can be related to scoliosis definitely, but all of us actually really have to have a full check. And I think a chiropractor can also help with that, because chiropractors, they will ask about your lifestyle as well. So they will get tips on what you might need to change to be a healthier you. Yeah.
Correct. And actually,
Okay.
sorry.
No worries.
Oh, sorry. I was going to add that there's also some research out that shows that, stress levels and psychosocial levels where you feel more stressed and just have a lot of things on your mind, sometimes they contribute to how you feel in your body as well. So being more stressed can be related to why you feel aches and pains and tired more easily. Yeah.
Mm-hmm. Definitely true. Yeah. For now, we don't have any questions anymore. So if you all have any questions, do keep it coming. Or if our speakers have anything, suddenly you want to share something interesting, you can do that as well. Yeah.
I have nothing particularly interesting to share.
Okay, no worries. No worries. We have a lot of thank you to both of you for being
Thank you,
well
everyone, for the
prepared with props,
questions.
especially.
Guess we all need a great chair like Dr. Zoey.
Told you people are eyeing on your chair, Zoey.
I'm just surprised that my chair is like my dining room chair that my parents helped me bring upstairs.
All right. I think let's wrap it up, shall we? Okay. Thank you to both our speakers. Thank you for taking the time, and thank you to our audience as well. We hope you learned something that might help you or even your loved ones, especially your child, if you suspect a scoliosis over there. Do remember that our spine will have only just one. Spare parts are never the same. So do really take good care of it, because when you have a good spine, you will be amazed on how much it can change your life and become healthier. All right, so I'm gonna end with our upcoming event. So I think we can take our two speakers down. Say bye. Bye, Zoey. Bye, Sarah. Okay, our next event we will have is tomorrow, and it is a home-based resistance training event. So if you always have this resistance band and you don't know what to do with it, now is the perfect chance for you. Go to our Facebook page or our Instagram page. You can find more information over there. Tomorrow, it is 16th of October, and it's a very special day for us chiropractors because it is World Spine Day. So happy World Spine Day, everyone. Please take good care of yourselves. Please stay safe. And if you do need any help, please go to your nearest chiropractor and they'll be able to help you. Thank you, everyone, and I'll be signing off. Goodbye. Thanks for joining us.